Hey there YouTube fans, how you going? I wanted to just do a quick little video diary here. I got rejected for surgery this morning, and this is part of the thing that's frustrating for people with chronic fatigue syndrome and myalgic encephalomyelitis, or yeah, that's right, sorry, that was it. Yeah, chronic fatigue, CFS, and fibromyalgia, which is probably the same thing. There's an argument that it could be the same thing. So they knocked me back because of my high blood pressure. So it was showing up as about 189 over 114 from memory, about 110, 114, 189 over about 110 or 114. So the anaesthetist was too worried to do any surgery, and I said, look, number one, I'm stressed out of my brain here. That's going to push my blood pressure up. I said, but I suffer from chronic fatigue and fibro. Also, they have me fasting, which includes no water, so I'm dehydrated. So it's a little known fact that especially diabetics or people with blood sugar irregularities, that you can be what's called hypovolemic, which means you don't have enough liquid or blood in your system, which will push your blood pressure up. So people with chronic fatigue, the research is that we are about at least 1 liter lacking in blood. And as soon as you move as well, I've noticed as soon as I move, like stand up and walk around, my blood pressure goes through the roof. They don't want to hear any of that. All that they said that I have to go back onto blood pressure tablets and show a history of lower blood pressures on a chart it out, and then they'll do the surgery. And it doesn't matter if I come back with the same 189 over 110 or whatever, they'll still do it. They said because they want me to they'll take the drugs again. For example, like amlodipine. So I have to wait now again several weeks and take a drug that I don't want to take. Especially since I'm pretty sure I understand what's going on, and it's those things: dehydration, the stress, and everything of having, have another surgery. So very, very frustrating. People, these diseases are not very well understood, fibro and chronic fatigue. Also, the fact that I've had gastric sleeve surgery, it's hard for me to keep the fluids up. That's a known given. So I notice I have been dehydrated with that, because also you're not supposed to drink at the same time you're eating. So at home here, now that I'm back from the hospital, my blood pressure is lower, but it's still high, and it's unusually high. There's a few reasons for that. I'm still dehydrated, so I'm going to drink a whole bunch of liquids, rest, relax a bit, try to calm down because I'm so wild about it, and then see if my blood pressure comes down into what's considered normal for me. All right. Please remember to like, comment, and subscribe. Hope that helps somebody. Bit of information, and teach yourself out. God bless.